Hi, I'm Dr. Vicki Ho from Smile Design Studio. I treat a lot of patients who come into me because they have locked jaws. Now, some people have jaws that are locked shut, so it means they can't open fully, and others come in because their jaws lock open. Now, they're all related to the jaw joint not being in the correct position, and therefore things don't line up properly and it doesn't work. Okay, so if you imagine a jaw joint, it sits like kind of like this. This is the joint, and it sits in a fossa. And in between the joint and the fossa, there is a piece of cartilage, which is a lubricating cartilage, which basically when you open the jaw, it doesn't only just pivot, like most joints just pivot, but this one not only pivots, it also comes right out the joint and right back again. So basically when you open really wide, you'll feel a little bump here, and that's with the jaw coming right out, and it goes over a little bump on the bone, and that's the movement. It translates and it goes back. And when you go from side to side, the whole joint actually moves from side to side. So it's got a great capability to adapt and move. Now, what makes the movement smooth is the movement of the ligaments and the cartilage that comes with it. Now, if the cartilage is not in the right place, the disc is a disc that sits in there. If it's not in the right place, it can act as a doorstop. So for example, if the jaw joint was further back than ideal, not in the center but further back, what happens then? The cartilage, which normally sits on top of it, is now in front. So therefore, when you go to open and when the jaw tries to translate, the cartilage now acts as a doorstop and it stops it from opening fully. So that's why the jaw cannot open and it locks shut. Okay, now what happens when it locks open? This is when the jaw opens too far. Maybe the ligaments are too loose. It comes wide open and it goes over. There's a lump on the bone here and it gets stuck in front of it. So these are two different ways that jaws get locked. The more common lock is actually locking shut. But if you have a really big yawn, sometimes the jaw joint can come in front of it. So what you can do immediately if it happens is just move your jaw from side to side to try and free it from where it's trapped. Usually when you're locked shut, try to protrude the jaw or move it from side to side to see if you can capture the disc back into the right place. That will allow the movement of the jaw to open. Now, if you're locked open, then try to massage and move the jaw again side to side, forward and back to see if you can unlock yourself from the bump in the bone. So it's just got caught and it needs to go back. So massage and give us a call if you have any problems.